Today's SnapOrtho sketch is going to be covering intertrochanteric or IT fractures. The ocean and tropical island will help us learn about IT fractures. In the water, you'll see two rock formations that look like the greater and lesser trochanters, which should reinforce the purpose of this sketch. On the left side of the screen, the island will represent stable IT fractures. Out at sea, in between the rocks, the pirate ship will represent unstable IT fractures. On land, the palm tree in the shape of a femur will help recall important characteristics of a stable IT fracture. Hanging from the tree are a backwards hat and a heart, which are our recurring themes for posterior and medial. The posterior medial cortex is important in determining IT fracture stability. Specifically, an intact posterior medial cortex is less likely to collapse into varus. Now back out to sea, where we'll learn about unstable patterns. At the front of the ship, there is a fracture in a reverse obliquity pattern, which is inherently unstable. This pirate is holding a $5 bill. He is standing next to a femur fractured below the lesser troch. Fractures with greater than 5 cm subtroch extension are also unstable. Next, we will talk about management. The two pirates on land and at sea are both holding a mallet, which is a recurring symbol for operative management. On land next to the stable pirate, there is a toolbox, which is a recurring symbol for ORIF. Inside the toolbox, you'll see two different treatment options, a sliding hip screw on the left and a cephalomedullary nail on the right. The seagull is on a wall that says 20.5 mm with outstretched wings. This should help recall the importance of the lateral wall and when you can use a DHS. Next, the treasure map that the pirate is holding will help emphasize tip to apex distance when using a CMN. The lag screw approaching the X on the map with less than 25 mm should enforce this concept. Moving back to sea, the pirate on the ship is holding an intramedullary rod, indicating that unstable fractures are treated with intramedullary nail. That's all for today's sketch. Whenever you need to remember the characteristics of stable versus unstable IT fractures, just think of this tropical island and unstable pirate ship.